This is Dr. Sheck, and today we're going to talk about passive range of motion exercise for your pet after they've had surgery on either the front limb or the back limb. This video will start with the back limb. So first, a quick anatomy lesson. Start at the bottom. These are the toes, the hock, which is the same as our ankle pretty much, and then we come up to this bend and the knee is right up here. And then further up, this is the femur, and then we come to the hip, which is up right here. And so this activity that we're going to work on is just going to mimic the normal motions of the dog's leg. Now you can do this with the dog resting and sleeping, or sitting on the couch, anything that makes him comfortable. If there's any pain, call before you do any of this. There should not be much in the way of discomfort. So we're going to start with the ankle first. The ankle moves in a range from about here to straight out. We don't want to put too much pressure on it. We don't want to hyperextend it or hyperflex it. So just a nice, gentle, light motion. And each joint we're going to do about 10 to 15 times as we're adjusting those joints, as we're moving those joints through the range of motion. Now the knee's a little bit more of a challenge because first you got to identify the knee. So if you feel over the top, you'll feel kind of a little pointy area. And the kneecap comes right in over where between my thumb and first finger over here. And then there's a small tendon here. And for the knee, we're going to try and hold, kind of stabilize the femur and the tibia, which is the shin bone in us. And we're just going to move it. And it'll flex to about 90 degrees. And then straight out, back, out, and back. And then for our hip, usually what I'll do is I'll find my knee and then take my hand over the long bone of the femur and bring it up to about where the hip, where I can feel the end of this bone. You can feel a big bump here. And stretch it out and up and out. And again, we only want to do what our dog, our patient will let us do. This is the same for cats as well. So only what they'll let us do. Each time we do this, we should get a little bit more extension or flexion depending upon the condition we're trying to treat. This is really great after stem cell therapy or PRP therapy in the joint, just to help kind of get things moving, get the fluid going within the joint capsule itself and into the joint. And that should do it. If there is any trouble, just definitely let us know. Thanks. Have a great day.